everyone. Thank you so much for being here. And thank you to our panelists for this important topic, especially focusing on a sector that is so important to all of us, the healthcare sector, where attacks on their networks could be a literal life and death issue. So I'm really eager to dive in and have some words of wisdom, hopefully, from all of you. And I wanted to start off with the United Healthcare attack. For those of you who weren't following, though I know a lot of you were, this was an attack on our healthcare industry, the biggest insurer in the country, and it affected basically a third of Americans. And the attackers basically got what they wanted. It was a ransomware attack. They got $22 million, and since then we've seen ransomware attacks, particularly on the healthcare sector, tick up. So with that not so positive backdrop, Chris, I wanted to start with you and get a sense of lessons learned from this. I mean, can something good actually come out of this?
Yeah, let's use MFA. How's that?
Yeah.
Let's start
That's
with that.
multi-factor authentication.
Right,
that's how the attackers got in.
Yeah.
Very simple defense there.
Well, I mean, you had a credential that was compromised. So some of the HIPAA basics come into play here. System activity review, IAM, identity and access management. That's something that we see customers, and by the way, we do only healthcare, cloud technology, and cybersecurity. That's where a lot of organizations fall short. They forget to get the keys out, they forget to rotate their passwords, they forget to do some of these basic hygiene types of things, and then you wonder why something like this could happen.
So they basically make it easy for attackers to penetrate.
It's like teeing it up with a beach ball.
Yeah.
Right?
Well, Brian, for you, coming from the government, from Health and Human Services, how do you help the private sector in this space? And do you feel like you could be doing a lot more?
No, great question, Gina, and thanks for the opportunity to be here. So at the Department of Health and Human Services, we've been really concerned for over the past year at the increasing sophistication, severity of the ransomware attacks on the healthcare sector. As Chris kind of hit on it, but I think just the complexity of the sector, the legacy devices, a lot of converging factors make it an easy target, frankly, and we've been sounding the alarm for some time. The department rolled out, working with our friends and partners in industry very closely, we rolled out a new strategy to deal with this threat in December, which I'm happy to go into in more detail, but we've been turbocharging those efforts in light of the Change Healthcare attack, the Ascension attack, just seeing the increasing frequency and sophistication of these threats. But we offer a lot of tools and resources for industry. We have something called the Health Industry Cybersecurity Practices, the HICCUP, that we developed with industry to provide very robust sort of guideposts and reference documents for particularly those small rural hospitals, the hospitals and parts of the healthcare ecosystem that have really narrow margins for a lot of reasons unrelated to cyber, and maybe their CISO or their cyber IT folks it's their third or fourth job. So we're providing simple resources to support them, but our strategy that we rolled out in December calls for more, and the president's budget had a $1.3 billion program in it for the Centers for Medicare and Medicaid to really drive resources into the sector as well, which we think is important.
Yeah. And Nathan, for you at Children's National Hospital, which I'm sure a lot of you in the audience know, I know my daughter has gone there, you're in the trenches. So how did you guys view this ransomware attack, and did it make you rethink some of your defenses and strategies?
Of course, and thank you for having me. I think it's important to note that from our perspective, Change Health wasn't just another ransomware attack. It was a black swan event. It was one that indicated and sort of helped us understand the underlying fragility of our system. We think of attacks on hospitals today as events that unfortunately, more often than not, cause degraded service in terms of systems for weeks, sometimes more than a month. And that's bad enough. But when we think about what we often deem third-party or fourth-party risk, how does an attack on a supplier to us or a supplier to our suppliers affect our environment? It's something that we're very concerned about, and often we don't have visibility into. But the Change Health breach was one that went even a step further because, and I'm loath to get too technical here, but the way payments are processed for healthcare organizations is not directly from the delivery organization, a hospital, to the payment payer, to the insurance company. We go through these clearinghouses. So a hospital goes to a clearinghouse and they're supposed to send the claim to a payer or an insurance company. In this case, it's even more complicated. Change Health had exclusive relationships with some of the payers, with some of the insurance companies, so that even though an organization like Children's National that didn't use Change Health as our clearinghouse had to go to Change Health in some instances in order to get to that insurance company that had an exclusive relationship with Change. So imagine how it is, how we must have to think about mitigating the risk. We don't have any relationship with Change Health. We have no contract. We have no mechanism through which we can force them to adhere to our security practices and standards. And yet we are affected to the tune of a significant amount of top-line revenue when it comes to our ability to process claims for our patients.
So, Chris, with that context, what do you tell your clients when they're faced with this kind of situation? Just as we had talked about, these can be life and death issues. I mean, if you shut down a hospital, you have patients who could be in serious trouble. So what are they supposed to do in that kind of situation?
Boy, I wish I had the answer to that. I'd be a very rich man. It's a challenge. Honestly, it's very, very difficult to control the behemoth. Let's just call United Health the behemoth here. They don't care. I mean, they obviously they care now.
Yeah.
But when they have those exclusive relationships and you can't do anything to influence their behavior, their resiliency, you can't even ask for a SOC 2 report without having a whole big challenge of why do you need this? You're nobody to us. So when I first saw this breach happen, I live in Scottsdale. One of my former colleagues called and said, "Hey, we're down hard." This was hours after it happened, and I'll tell you what, it was calamity across our country. I initially thought there has to be some kind of, and I'm a libertarian by nature, but there has to be some kind of standard that says you can't put all your eggs in one basket, healthcare sector. That was a massive failure structurally,
Yeah.
and so I would hope that HHS come in, especially in your role, Brian, and say, we shall not put all of our eggs in that one basket. We need to decentralize some of this stuff to make it more resilient.
Absolutely.
Is that part of some of the game plan?
So that is part of our strategy. So I mentioned we rolled out in December, our new roadmap has 4 pillars. The first was, which we expedited, was the publication of voluntary healthcare-specific cybersecurity performance goals, which I would note includes MFA, which was an issue obviously in Change, as
But
well.
should it be voluntary
Yeah,
at
well,
this point?
so-
Should it be?
I'll get to that in a moment.
Heavens
But it also included an element focused on third-party risk and systemic risk from a resiliency perspective. And they're built around the idea of protecting patient health and safety. That's our paramount concern. But the other pillars, one of the other pillars is focused on accountability and enforcement. And we're in the process now, we've talked about it a little bit publicly, of updating the HIPAA security rule and looking at other levers the department may have to drive those kind of practices that are embodied right now in the voluntary CPGs across the sector. So we absolutely recognize more needs to be done from a mandatory minimum standard perspective. That's consistent with the President's National Cyber Strategy, and we're pushing as quickly as we can in that direction.
Yeah. And Nathan, for you, what do you think should be done to try to, to the extent that you can, try to prevent or mitigate these kinds of situations? What do you need sort of forced upon your hospital to ensure, and the healthcare industry writ large, to help ensure that these kinds of attacks aren't so massive? And to Chris's point, should they be decentralized? Because United Healthcare was basically like a single point of failure. You know, they were kind of the too big to fail in the healthcare industry, and we've seen the ramifications to that.
Right, so I think it's a very good point, and there are a lot of great questions in what you just asked. I don't think that United Healthcare is an example of something that hospitals or providers could have done anything about. I do think, and I agree
You were
with
just
Chris,
stuck, basically.
to a very large degree, yes. And I think that Brian and his team are doing great work. Chris Garcia, the Health Sector Coordinating Council, they're looking at other places of single points of failure in the system, systemic failure in our system, and we need to get ahead of it. This is, as bad as Change Health was, it didn't bring down the system. It could have. It really could have. And I think
And what do you exactly mean when you say it could have brought down the system?
we saw insolvency happen in individual point organizations, individual practitioners' offices, small practices. In one case in Oregon, I think insolvency of a small hospital.
Because they couldn't get paid. Is that
right? But we didn't see across the entire system. We didn't see hospitals failing to make payroll. We did see a lot of hospitals. This I think largely isn't public, so I won't name names. But we did see a lot of hospitals draw down on their credit line and effectively take a loan in order to float insurance companies. Now, I think that's something that the system is working its way through and trying to equalize. But boy, that's a really, if you think about who makes money in healthcare, it's really hard to envision a nonprofit hospital system taking a loan in order to float an insurance company. That said, there are things that we can improve in hospital cybersecurity. There's a tremendous amount of work to be done there. We need help. I mean, I'll just say it, straight out. I feel like I am one of the luckiest CISOs, Chief Information Security Officers in healthcare. I have fantastic support from my executive leadership and my board of directors. They're very astute. They're very smart. They're very thoughtful. They ask me very hard questions. And I think we do a really good job. It does not mean by any stretch of the imagination that we aren't subject to the same kinds of attacks that have happened across the rest of healthcare, but we have to get out ahead of the curve. And you talked about how do you deal with it. We need to get a lot better at response and recovery. We need to get a lot better at shortening the time from a successful attack, especially a ransomware attack, to getting our system back online, recovering, and being able to operate at full capacity. And we need help. We need help. I mean, there's opportunities for the government to get engaged here and help us out.
Well, and we're basically out of time, but before we leave, Chris and Brian, I wanted you to just, in a single sentence, what's the best thing that you think firms in the healthcare industry could do to mitigate this? Is it really just taking care of the basics? Because that's really how we're seeing a lot of these attackers get in.
It's Larry in the basement clicking on things. It's hygiene. It's getting rid of end of life. It's the hygiene stuff. And I'll just finish by saying, we're never going to stop these people until the pain of the perpetrator is greater than the gain that they're getting. So we have to have some kind of offensive that Australia is already doing, for example.
And make it worse for them.
Make it worse for the bad guys, right?
Yeah.
And Brian?
And I would just say, again, I mentioned them, but the healthcare-specific cybersecurity performance goals are the most high-impact, basic practices. Make sure there's 10 essential, 10 advanced. Make sure you've implemented those. And going forward, I think I agree with everyone here. More needs to be done, and we're trying to rise up to meet that threat and bring more resources to the sector to bolster cybersecurity. And resiliency is key too. That was hit on here, but you're never going to prevent all the points of entry and an attack. It's being able to recover quickly after one happens to protect patient health and safety.
Great. Well, we're hoping after what we've seen occur that you guys all get the help that you need. So thank you so much.